Welcome to a totally awesome video. If you deal with back pain, wake up stiff, struggle getting comfortable in bed, feel locked up when you stand, or feel like your body is constantly fighting against you just to get through the day, this video is for you because back pain is one of the most misunderstood health issues on the planet. Millions of people are walking around thinking their back is damaged beyond repair, when in reality the body is often far more adaptable, recoverable, and intelligent than people realize. And one of the biggest problems with back pain is that people usually search for one magic fix, when the reality is, it's normally a combination of things working together that creates the biggest improvements. Your spine is not just a stack of bones. It's an entire support system made up of discs, nerves, joints, stabilizing muscles, connective tissue, fascia, blood flow, posture control systems, movement patterns, inflammation responses, and even neurological stress responses from the brain itself. That's why two people can have almost identical scans, while one person has severe pain and the other feels almost nothing. Modern medicine has completely changed how it looks at back pain over the years because experts now understand that many cases of common lower back pain are influenced not just by structure, but by stiffness, muscular weakness, poor movement patterns, prolonged sitting, sleep quality, inflammation, recovery, stress hormones, body weight, inactivity, anxiety, and nervous system sensitivity. One of the simplest things that still genuinely helps many people is proper sleeping support. The old lazy S position is still recommended by many modern sleep and spine specialists because when you lie on your back with a pillow supporting the head and another underneath the knees, it can reduce tension through the hamstrings and pelvis, which may decrease stress on the lumbar spine. A lot of people don't realize tight hamstrings can constantly pull on the pelvis and lower back all day long. Slightly bending the knees relaxes that chain of tension and often reduces compression through the lower spine. At the same time, sleeping flat on the stomach is still considered one of the roughest positions for many people because it twists the neck and compresses the lower back for hours at a time. Side sleeping with a pillow between the knees is often one of the best overall positions because it helps align the hips, pelvis, and spine more naturally. Even small things like the right pillow height or mattress firmness can make a bigger difference than people expect. Extremely soft mattresses can let the spine sink into awkward positions, while overly hard surfaces can create pressure points and muscular tension. For many people, medium firm support tends to work best. But one of the biggest changes in modern back pain treatment is movement. Years ago, people were told to rest in bed for days or weeks. But now experts know that too much immobility can actually make many common types of back pain worse. Muscles weaken, joints stiffen, circulation decreases, and the nervous system can become even more sensitive to pain signals. Gentle movement is often one of the most powerful tools available. Walking is one of the best starting points because it increases circulation, improves spinal movement, activates stabilizing muscles, and helps lubricate joints without placing huge stress on the body. Even short walks throughout the day can help. For many people, long periods of sitting are actually more damaging than movement itself because sitting for hours tightens the hip flexors, weakens the glutes, stiffens the thoracic spine, and increases pressure through the lower back. Stretching can help too, especially for the hips, hamstrings, glutes, and lower back. But the key is controlled gentle stretching rather than aggressive movements. Things like pelvic tilts, knee-to-chest stretches, child's pose, cat-cow movements, gentle spinal rotations, and hip mobility work are commonly recommended by physiotherapists because they help restore movement without excessive strain. Core strengthening is another massive factor people misunderstand. Most people think core means six-pack abs, but the real core includes deep stabilizing muscles around the spine, pelvis, diaphragm, and hips. Weak stabilizers force the larger muscles to overwork and compensate. Exercises like bird dogs, dead bugs, bridges, modified planks, and controlled bodyweight movements can help improve stability without overloading the spine. Swimming and hydrotherapy are also incredible for many people with chronic back pain because water reduces gravity stress while allowing movement and muscle activation. That's why so many rehabilitation programs use pools for recovery.
Yoga and Pilates have also become extremely popular for back pain management because they combine flexibility, breathing control, posture awareness, balance, and controlled strengthening. And interestingly, breathing itself matters far more than most people realize because shallow stress breathing can increase muscular tension through the neck, ribs, shoulders, and lower back. Controlled deep breathing helps calm the nervous system and reduce muscular guarding.
Then there's physiotherapy, which for many people can be one of the best investments possible because a good physiotherapist doesn't just treat pain. They assess movement patterns, muscle imbalances, posture, flexibility, joint mobility, and stability weaknesses to help identify what's contributing to the problem in the first place.
Massage therapy can help reduce muscle tension and improve circulation. Trigger point therapy and self-myofascial release using things like tennis balls or foam rollers may help release tight muscular areas, although it's important to avoid aggressively pressing directly into the spine or pushing through sharp nerve pain. The goal is controlled pressure on tight muscles, not trying to force the pain away through brute force. Heat and cold therapy can also help in different ways. Ice packs are often better for fresh inflammation or flare-ups because they may reduce swelling and numb irritation temporarily, while heat packs, heated blankets, warm baths, and hot showers are often better for muscular tightness and stiffness because heat increases blood flow and helps muscles relax. And then there's medications and topical treatments. In Australia, many people start with over-the-counter anti-inflammatory gels and creams from chemists containing diclofenac or ibuprofen. Products like Voltaren are commonly used for muscular and joint pain because they target inflammation locally without always needing higher oral doses. Pain relief creams containing menthol, capsaicin, or warming ingredients can also create temporary relief through sensory distraction and increased circulation. Some people also use magnesium creams or Epsom salt baths, although the scientific evidence for magnesium absorption through the skin is still debated. Even so, many people report relaxation benefits from warm magnesium baths simply through heat and muscle relaxation effects. Oral medications can include things like paracetamol, anti-inflammatories, muscle relaxants, or stronger medications prescribed by a GP depending on the situation, although stronger pain medications are now used more cautiously because modern medicine recognizes the long-term risks of dependence, tolerance, and side effects. That's why many doctors now focus more heavily on combined approaches involving movement, rehabilitation, posture correction, sleep improvement, stress management, and strengthening rather than only masking pain. Seeing a GP is important if pain becomes persistent, severe, or starts interfering with normal life because sometimes back pain can involve disc injuries, nerve compression, arthritis, spinal stenosis, inflammatory conditions, kidney issues, or other medical causes that require proper assessment. Doctors may refer people for scans, physiotherapy, pain specialists, rehabilitation programs, exercise physiology, or specialist spinal care depending on the symptoms. Diet also plays a much bigger role than people think because chronic inflammation throughout the body can influence pain sensitivity. Diets high in ultra-processed foods, excessive sugar, alcohol, and poor nutrition may contribute to systemic inflammation and recovery problems over time. Meanwhile, diets rich in protein, vegetables, omega-3 fats, hydration, fiber, minerals, and anti-inflammatory foods may support tissue repair, muscle function, and overall recovery. Body weight can matter too because excess abdominal weight increases mechanical stress on the spine and pelvis, particularly through the lower back. But at the same time, crash dieting and excessive exercise can make things worse. So the focus should always be sustainable movement and gradual health improvements, rather than punishing the body. And honestly, one of the most overlooked factors in chronic pain is stress itself. Chronic stress changes hormone levels, muscle tension, sleep quality, inflammation, and how the brain processes pain signals. The nervous system can become hypersensitive over time, meaning the body stays stuck in a constant state of guarding and tension. That's why sleep quality, recovery, mental health, relaxation, sunlight, social connection, and overall lifestyle can all influence pain levels far more than people realize. Now, obviously, there are situations where back pain needs urgent medical attention, especially if someone experiences severe weakness, numbness, loss of bladder or bowel control, unexplained weight loss, fever, chest pain, major trauma, or pain shooting aggressively down the legs, because those symptoms can indicate more serious conditions. But for many people dealing with common mechanical back pain, stiffness, muscular tension, posture-related issues, or general lower back discomfort, the biggest improvements often come from combining multiple smaller changes consistently over time, rather than chasing one miracle cure. Better sleep support, better movement, better posture, better recovery, better stress management, better strength, better flexibility, better circulation, better habits. Because the body is constantly adapting to whatever we repeatedly do to it every single day. And when you understand that, back pain starts making a whole lot more sense. If you found this video useful, make sure to like, subscribe, and turn on notifications because we've got plenty more videos coming on health, science, technology, the human body, and everything in between. Thanks for watching, and as always, stay totally awesome.